Teď se svým nosem nejsem spokojená prakticky vůbec, protože vlastně už od dětství vlastně si přeju nový nos, protože všechny ty urážky a blbý komentáře vlastně se směřovaly tímhle vždycky směrem. A vlastně i dneska mi to občas nikdo nezapomene připomenout, takže je to docela nepříjemný a jsem si slíbila, že to prostě změní a tak jsem tady, no. Nevím, si to nemůžu představit, ale určitě to musí být lepší než teď. Prostě musí.
The patient whose name is Teresa has a thin nose but high bridge and big hump on the dorsum. So she was unfortunately from the profile photos and the profile of the nose. So she wanted to reduce the hump on the nose and the tip. It was blunt and she wanted to have sharp nose. So we reduced during the surgery. We reduced the nasal cartilages and the hump. We cut the hump. So then was necessary to cut the sides of the nose. In spite of that, the width was quite okay and the width was very thin and the skin was very thin. But to reduce the bridge, which would be too broad on the dorsum of the nose, was necessary to cut the nose on the sides and to put the sides together to achieve the smaller nose with a sharper tip. The whole surgery was done in general anesthesia. We provided the so-called closed rhinoplasty. That means that the cuts are inside the nostrils, there's no cut outside on the skin. We reduced the cartilages in the nasal tip to achieve more sharpness at the nasal tip, and then we cut the dorsum of the nose to reduce the profile. Then we cut the sides and put the sides together in the smaller nose with a sharper dorsum and sharper nasal tip. After that, she got some tamponade into the nostrils and outside the cast. The cast is necessary to have on the dorsum for 10 to 14 days, and the tampons in the nose are 48 hours. Then they are removed. All the stitches which are inside the nostrils are absorbable, so there's no need to remove them. She stayed on the clinic 2 days and 2 nights. After that we removed tamponade and she could go to home or to the apartment if she's outside from Prague or from Czech Republic, but she left here. And the next checkup was 10 days after the surgery. We checked the external cast, we could remove it, we could check the shape of the nose and then put the cast again on the nose. It's removed 2 weeks after the surgery and the patient should put it on the dorsum, this cast, only by night to protect the nose when she's sleeping or when she could put down into the pillow or etc. And the first checkup, when the cast is removed, the nasal tip is very swollen, so the patients are surprised with the volume of the nasal tip, but with help of the pressure massage and with the cooperation of the patient, this is reduced within several weeks after the surgery. The specific situation is the patients who are coming from abroad, mostly from the UK or Germany, and we make the next checkup, and it's the last and first checkup after the surgery. It's approximately 7 days after the surgery. We take off the cast, we check up the shape, we check up the bruisers and put the cast again on the nose and they can go home. So the situation is same to the Czech patients, that the cast should stay approximately 2 weeks on the nose and then 2 weeks only by night. The stitches are absorbable and the bruisers and swelling disappear within the worst is in the first 2 weeks, but the nasal tip and surrounding area is swollen approximately 2-3 months after the surgery, but it's not visible for other people. The patients can see that still the nose is swollen, but there are no signs of some bruisers or anything like this. So the recovery for the going to work is approximately 2 weeks after the surgery. And I must say it's not painful. In spite of that, there are bruises in the face and in the nose, and the face is quite swollen after the surgery. I must say it's not painful.
A reakce okolí byla pozitivní. Všichni říkají, že mi to moc sluší a že je to určitě lepší. A jakože to vážně chtělo, že ten nos byl prostě velký. Bratr už se mi tolik nedobírá, teď se mi sice dobírá jinak, ale on musí, že jo. A určitě taky se jim to líbí a máma je strašně spokojená. Tak, ta je úplně nadšená z toho. Podporovali mě, jsem za to ráda. Já jsem fakt moc spokojená, vůbec to nebolelo. A určitě je to taková jakože změna fakt k lepšímu a jsem fakt strašně ráda, že to mám. A určitě to můžu každému jenom doporučit, protože pan doktor Kulhanek je fakt šikovný. To je můj splněný sen, to je úplně bomba. To jsem si to vlastně přála od dětství, takže